Maryland sees another spike in coronavirus cases. There are nearly 16,000 COVID-19 cases here and 680 people have lost their lives. Slowing down the rise is something Governor Hogan is focused on as he looks towards slowly reopening the state. Let's bring in Amy Kawada now. She's live with more. And what can we expect from the governor today as he updates us on the state's recovery plan? Amy.
Yeah, good morning, Max. It's all about the numbers here. And in the latest report, it shows in Maryland, the total number of people in acute and intensive care has actually gone down by 27 over the past day to 1,405. However, other numbers are significantly up.
Governor Hogan's plans to gradually reopen Maryland will be released today and will rank types of businesses based on the risk they could pose.
They're kind of based on high touch or low touch, physical distancing, certain things. You know, we'll be able to get some kind of quality of life things back where people can get out of their homes, get outside, do things, and still in a safe way.
The keys to reopening will involve expanding testing and access to personal protective gear, tracing the contacts of those who are positive, and expanding hospital beds, which has already been done across the state. But the numbers have to go down first, and Maryland has reported 962 more coronavirus cases and 49 more deaths.
Unfortunately, we're still kind of gradually climbing and not able to start getting over that hump yet.
Baltimore's Mayor Jack Young announced more than $5 million has been secured to help the city's small businesses.
Small businesses are the backbone of the city of Baltimore. They are the ones who actually hire local.
The mayor says the business community has been understanding.
To be honest with you, I haven't gotten any calls from anybody asking to reopen. People want to feel safe. They want to make sure that the curve is actually slowing.
And the governor says we need a 14-day downward trend before we even think about reopening the state. Again, we are expecting to hear the full reveal of Maryland's Road to Recovery plan sometime later today, so make sure you stay with us right here on WJZ. Reporting live this morning, I'm Amy Kawada for WJZ.
The numbers of coronavirus cases in the U.S. continues to rise. Right now, there are nearly 870,000 cases across the country. Nearly 50,000 people have died. Another relief package is heading to President Trump's desk. The House passed a nearly $500 billion measure last night, and most of that money will go towards the Paycheck Protection Program, helping small businesses. Maryland Senator Chris Van Hollen says this was a top priority.
In addition to replenishing the fund, we also tried to make sure this time around that more of the funds went to really small businesses, mom and pop operations, not just some of the sort of big chains and others that are less needy.
The remainder of the money will go towards helping struggling hospitals and enhancing testing across the country. More than 47,000 Marylanders filed for unemployment last week. The Department of Labor has been trying to keep up with every claim, but they admit they're behind. They're launching a new program to catch up. Here's Annie Rose Ramos.
Desperate people showing up to the Department of Labor offices.
It's closed, I guess.
Only to find they're closed.
My first thing was to file unemployment, and I haven't heard anything since then.
One of many who can't get through to the unemployment offices.
The first week, I didn't expect to hear anything. The second week, I tried calling them, and it went straight to busy signal.
We're just a little overwhelmed in terms of taking all the new claims.
It's why the Department of Labor is creating something new.
Every Marylander can now apply online.
An online application launching Friday.
Marylanders can go to mdunemployment.com. and they will be able to click the link to file online.
This now includes people who were not previously eligible for benefits, like the self-employed, independent contractors, sole proprietors, and those with insufficient work history.
Those people previously had to call in, and we know that there's frustration in trying to reach us.
Vernon has been trying for weeks.
Well, I don't know if my unemployment is going to come in or not. You know, where am I going to get my answers from?
Questions the department is trying to answer.
I've been in those claim centers watching our claims takers get emotional as they're spending time with every single claimant.
Knowing all too well, every claim comes with a story.
Upset, I'm worried, I'm scared, I don't know what's going to happen next. You know, it's kind of I don't know where to go from here.
And in the coming days and hours, the Department of Labor says they're launching a virtual agent and a mobile app so that applicants can get up-to-date status updates about their application and their payments. I'm Annie Rose Ramos reporting for WJZ.
The Maryland Army National Guard releases video of its citizen soldiers helping healthcare workers conduct coronavirus testing at the Maryland State Fairgrounds in Timonium. More than 2,000 National Guard members have been activated to help out. Now, to prevent the spread of the virus, Kennedy Krieger is just the latest hospital now treating many of its patients virtually. Stetson Miller explains how the institute is providing care for children with learning disabilities.
Journey Jeffries has been undergoing occupational therapy and speech therapy at Kennedy Krieger after she was born prematurely. But when COVID-19 started spreading, her treatment couldn't continue normally, so they turned to the Institute's telehealth services.
It's very interactive. Myself and my husband can participate in therapies with the therapist.
Her mother, Asha, says the treatment is very helpful and offers a different approach for the whole family.
Since it's via telehealth, it's like you're involved in a therapy session with your kids.
Fortunately, Kennedy Krieger was already doing telehealth with military families for 3 years before the coronavirus pandemic and is now doing 1,200 telehealth sessions a day.
That really allowed us to respond immediately to COVID-19 such that we were able to build on that foundation and essentially immediately convert our care over to a telehealth model.
For Journey, that means getting active.
Journey usually starts out occupational therapy with yoga.
And doing tabletop exercises that she can see virtually.
She can actually see her therapist and see the activities at the same time.
In some cases, doctors are finding that treatments are even more effective through telehealth.
It's more effective in certain situations if you can actually provide the care in the home, as opposed to providing it in the clinic and then having to transfer it.
Dr. Crockett says telehealth services will continue to be offered to patients even after the coronavirus restrictions are lifted. At Gwens Falls Parkway, Stetson Miller for WJZ.
A 16-year-old girl in Montgomery County is on a mission to keep senior citizens from feeling isolated and alone. The Ethel Project, named after Haley Wilson's grandmother, actually began months ago as part of her high school entrepreneurship program. She spent several weeks visiting an assisted living home, teaching the residents how to use Skype. And when COVID-19 hit, she began working remotely, answering tech questions via email, and even creating a step-by-step guide so the facility staff could help even when more seniors start Skyping.
It's perfect for this because now they're really on lockdown and no one can come in or out.
They loved it. Yeah, she's made a lot of friends here when she was able to come in the building.
Haley says her end goal is to now get the project into more communities. Of course, WJZ has your back in our community with everything you need to know. Just go to WJZ.com and look under top stories for a list of resources. Plus, the most important links and numbers are under quick links.